This week is National CPR Week and highlights why each and every one of us should be properly trained to perform this life-saving emergency response technique. Whether you're a parent, a sports enthusiast, a teacher, or just someone who cares, knowing how to perform CPR is a very valuable skill. Unfortunately, most of us have only seen it performed incorrectly on TV or in the movies. So we went to chat to some experts to get some basic guidelines and find out how everyone can learn CPR.
CPR Week is on the National Health Calendar, but the Resuscitation Council of Southern Africa uses it as an opportunity to take CPR to the people. We want to ensure that as many members of public who would not normally be on a CPR course get communicated with, spoken to, shared with, maybe learn how to do compressions and give them a flyer with some basic steps of how to do CPR while they wait for the ambulance to arrive. Everybody needs to know how to do CPR. Learning CPR is not an optional extra. This is a critical skill, and if you don't know it in the moment that someone isn't breathing and their heart isn't beating, the clock is ticking, and in the next couple of minutes, while they're still viable, if we started CPR, the patient would have a good chance of resuscitating and being alive again. But if nothing happens for those first 5-10 minutes while we wait for the ambulance to come, the patient will become unviable. There'll be no more a chance of us actually resuscitating successfully. CPR is actually quite easy to do. There is some technique, and it's about body position and how you do compressions, and that's best learned in a classroom where you work on a mannequin and get practical experience in how to do really good depth of compressions, good rate of compressions. So practicing it would be the first prize. If you haven't done a class though, and you just had some steps, basic steps of how to do compressions, you could most probably put your hand in the center of the chest, push hard, push fast, and at least pump blood around the body until the ambulance arrives. The steps of CPR are very simple. Starts off with first hazards. Make sure that you're in a safe environment, that it's safe for you to be there. Otherwise, maybe you should run away and just call for help. See if the patient will respond. Tap them, talk to them loudly and see are they unconscious or not. If they don't respond, are they breathing? Just scan. Can you see any signs of breathing? If they're not breathing, scream for help. Make sure somebody comes to help you. Send them, go quickly, go phone for an ambulance. In the meantime, you need to do CPR while you wait for them. So you're going to expose the chest, put your hands on the chest, and you're going to push hard, push fast, at least 30 compressions. If you've got something to breathe with, then give 2 breaths and go straight back to 30 compressions. So really it's very simple. Hazards, hello, call in for help, and then get into 30 and 2 and 30 and 2 and 30 and 2 and keep going until the ambulance arrives.